Hello and welcome to my YouTube channel. Today I'll be discussing something that I consider very important that most people should have some very basic idea about. And that condition is called dysmenorrhea. It simply means painful period or painful menses. Usually when we say this, it means something that is dysfunctional, something that is problematic. Firstly, periods essentially could be absolutely normal without pain. However, for some reason that I'm going to explain, young ladies or females could have painful periods. The first period a lady experiences is called menarche, and it's important that that date is taken note of. It comes with abdominal pain just before or during the period. Pain may spread to your back. The problem is that the pain may be so incapacitating that you don't even want to do anything. You just want to lie in bed and do nothing. The womb contracts. Womb tightens, causes you a lot of pains. Why does this happen? Because the body releases chemicals called prostaglandins that can cause the uterus to contract, making the abdomen to hurt. Sometimes this could just be a normal thing that occurs in patients and then they develop painful periods. However, there could be underlying conditions such as endometriosis or adenomyosis. Very briefly, in endometriosis, the uterine lining is present in other areas where it shouldn't be. And in adenomyosis, the uterine lining now occurs or grows into the wall of the uterus. Sometimes patients have fibroids, and these are benign growths, making the periods painful, sometimes. And then if there is infection in the reproductive system or organ, which is the uterus, that is the medical name for the womb, the fallopian tubes, and the ovaries, you could have a condition called pelvic inflammatory disease. You could have painful periods, as well as if there's a placement of an intrauterine device, which is supposed to help prevent pregnancy. That could also be the reason why you're having painful periods. What do? Sometimes you do nothing. If the pain is not so severe, you could let that go. However, if the pain is causing you discomfort, simple over-the-counter medications such as analgesics, paracetamol, or use of ibuprofen. Now, it's important to mention that ibuprofen belongs to a class of medications called non-steroidal anti-inflammatory drugs. Essentially, what they do is that they block the production of prostaglandins. Remember that word. Prostaglandins are the same chemicals that are released. So when these medications are taken, they block the prostaglandins, and there you don't have the pain. Now, if these measures do not work, one of the things that a doctor could do is to prescribe contraceptive pills. Now, the question is, why would a young lady be given contraception? The point here is this: it's not to prevent pregnancy in this instance. The reason why that is done is to prevent the periods from occurring. Remember, dysmenorrhea is painful periods. Therefore, if you prevent periods, the pain shouldn't come. If these measures do not work, it will be necessary to refer to a gynecologist who is a specialist that is trained to handle these conditions. What the specialist will then do is to carry out investigations such as ultrasonography, or sometimes it may be required to do laparoscopy to find out whether these other conditions that I've mentioned, the fibroids, endometriosis, or adenomyosis, is present. But in most cases, for a young lady that's just having her periods, it's simply a case of prostaglandins being released, causing the pain. And I hope this time around you've learned something and you will subscribe. Thank you, and see you again.